Hello. On behalf of U.S. Department of Health and Human Services and the Centers for Disease Control and Prevention, I would like to welcome everyone to the National Influenza Vaccination Disparities Partnership webinar covering the cost of flu vaccination, public and private resources. My name is Adam Unkson, and I work for Kaufman and Associates. Carlos Velasquez with HMA Associates and I will be the moderators for today's webinar. Before we begin, I'd like to mention some housekeeping items. There are two main features of your webinar interface. The PowerPoint slide presentation is in the main window, and the Q&A box is in the bottom right-hand corner. Today's question and answer period will be at the end of the presentation, but if you have questions for our presenters, feel free to submit your questions in the Q&A box at any time. If you need technical assistance during the webinar, please also enter your question in the Q&A box. Today's webinar is being recorded, and the recording will be available online at cdc.gov. At the end of the webinar, we will post a short evaluation, so please stay online. I will now hand the webinar over to Carlos Velasquez. Thank you.
Thank you, Adam. I want to thank everyone for being with us this afternoon. I am joining you with my colleague, Jonathan Collins in Atlanta. And we have colleagues that are joining us from Washington, D.C. and Spokane, Washington, along with our partners in New Jersey, California, Texas, and the District of Columbia. Our reach is nationwide, and our interest in promoting flu vaccination and protecting our loved ones is global. I want to give a special thanks to our partner and friend Sharon Rick, HHS Regional Health Administrator for Region 4, as she is hosting us in her office in Atlanta, and she gave us this beautiful room. I didn't really expect such luxury accommodations, but I truly appreciate it. As Adam said, my name is Carlos Velasquez, and I'm the president of HMA Associates, and I also serve as the deputy director of the CDC-funded Partnership Building Project to support the National Influenza Vaccination Disparities Partnership. Strategically, we think it is important to understand the resources that are available to our partners in their local health jurisdictions for how to cover the cost of flu vaccines. Since it is sometimes challenging to get vouchers for flu vaccines, we want to highlight other sources of funding for vaccination. Our webinar today will provide a broad overview of various access points for flu vaccines, and we will share successes some of our partners have had to promote flu vaccination at the local level by leveraging resources and securing the support of both public and private resources. Let us begin our review with Vaccines for Children program, or VFC. And as we cover VFC, it's important to understand that the goal of the VFC program is to help provide vaccines to children whose parents or guardians may be unable to afford them. Eligibility: a child must be younger than 19 years old and be one of the following: Medicaid eligible, uninsured, underinsured, American Indian, or Alaska Native. Now, in relation to the VFC, it's important to realize that funding for the VFC program is approved by the Office of Management and Budget and allocated to the Centers for Medicare and Medicaid Services, CMS, to the Centers for Disease Control and Prevention. CDC buys vaccines at a discount and distributes them to grantees, i.e. state health departments and certain local and territorial public health agencies, which in turn distribute them at no charge to those private physicians' office and public health clinics registered as VFC providers. Now, children whose health insurance covers the cost of vaccinations are not eligible for VFC vaccines, even when a claim for the cost of vaccines and its administration would be denied the payment by the insurance carrier because the plan's deductible had not been met. Nationwide, there are about 44,000 providers. Each state VSP coordinator can provide a list of doctors enrolled in the VSP program. So if you Google your own VSP program locally, you'll find out all the providers that are available. Other places that provide vaccinations include public health clinics, federally qualified health centers, and rural health clinics. And we have with us a VSP provider who has done amazing work to promote flu vaccination and other health services to young people in New Jersey, and I'll be introducing him to in a bit so you can learn about all the successes he's been able to implement. Now, in addition to Vaccines for Children programs, there are several other government-funded sources for free vaccines, including Medicare Part B, or medical insurance, is part of the original Medicare and covers services and supplies that are medically necessary to treat your health condition. This could include outpatient care, preventive services, ambulance services, and durable medical equipment. But the most important part here is that it also covers flu vaccines. Medicaid covers childhood immunizations, including the flu. It will also pay for some adult immunizations, including flu, depending on the state. So again, make sure that you Google your own Medicaid office in your state or your health jurisdiction to get that information. The coverage and eligibility for both children and adults varies by state, so you want to make sure what can be covered. Now, TRICARE is a health insurance offered to active duty military retirees, veterans, activated guard and reserve members, and military families. It provides free flu vaccination. In addition, flu vaccinations are covered by private medical insurance. While we may be primarily focused on funding and the cost of vaccinations today, it's also true that time and access to the flu vaccine can be challenges for some people. Providing convenient flu vaccination opportunities for people covered by private insurance can be an effective strategy. So now let's talk to our panelists today about how they are addressing funding for flu vaccines. Our first panelist that we're going to hear from is Dr. Jeffrey Bienstock, who is a managing partner at Pediatric Care Associates in Fair Lawn, New Jersey. He is the president of the New Jersey chapter of the American Academy of Pediatrics, medical director of Healing with Children in New Jersey, and president of the New Jersey Pediatric Society, and board of trustees members, Partnership for Maternal and Child Health of Northern New Jersey. Welcome, Dr. Bienstock. How are you?
I'm doing great, thanks. I actually just returned from a legislative conference down in Washington where I was not being questioned by members of Congress as Mark Zuckerberg did yesterday. But I had a great day talking about ending gun violence and what we need to do as far as gun safety. But it's great to be here with everybody.
Well, thank you. I have a few questions for you, Dr. Bienstock. Can you describe working with Vaccines for Children's program and how these free vaccines have helped your community locally?
Well, our practice right now is 4 locations. We're 15 providers in northern New Jersey. We have a real dynamic mix of physicians as well as our staff and obviously as well as our patients. Approximately 20 to 22% of our patients are Medicaid patients. Obviously, those are ones that for the most part are receiving VFC vaccines. Our practice was certified by the NCQA as far as medical centered home through the PCMH program several years ago. We have worked very closely with the state of New Jersey to make sure that our vaccines are available, stored appropriately, and administered in a timely fashion to our patients. I work with a wonderful group of nurses who make sure of this. We have special refrigerators to allow us to store our vaccines with backup generators so we don't have any loss of power where we might lose vaccines.
Excellent. And tell me a little bit about some of the special events that you've had, like the carnivals, to promote flu vaccines in your community.
Yeah, it was pretty cool. So roughly 5 years ago, right around this time in the middle of April of 2013, I awoke in the middle of the night, startled myself and my wife, and she says, "What's wrong?" And I said, "We need to have a flu carnival." And she said, I don't know what you're talking about, but I think you need to go back to sleep because you're having a bad dream. Well, when I awoke in the morning, I realized it was not a bad dream, and it was actually a wonderful dream. I spoke to my practice manager, spoke to my head nurse, spoke to my 3 partners at that point, and explained that we needed to have our June meeting where we would have a off-site discussion over where we're headed in the future of our practice. The main item being the idea of a flu carnival, which I envisioned happening 3rd week in September on a Sunday, where we would close our main office that we typically have open for emergency sick visits for our patients. We would set up our parking lot as if it was a carnival. We had face painters. I thought we would have sand art, a DJ, balloon art, a magician, as well as handing out many of the informative pamphlets that we typically use in our practice that discusses many areas of health, not only immunizations, not only the influenza, but many other things as well, such as hand washing, dental care, making sure patients understood that we were there for them. We also invited our dietitian that we regularly refer to, as well as 2 of our clinical psychologists that see many of our patients, to be available to parents should they have any questions. My staff worked very hard through the summer. We made sure that we were ready. And on that 3rd week, Sunday at 9 a.m., as we opened our doors, we had parents coming through with their children, willing for their children to receive their vaccine. And once the vaccination process was completed, data was up to the New Jersey information system that tracks our immunizations. The kids were free to roam, play, have a good time, and the weather was perfect. Over the next 4 years, our numbers have increased, and this past September, on September 24th, we were able to vaccinate over 1,000 of our patients. Again, this is for our patients only. We have always had flu clinics, whether they were in the mornings, in the afternoons, the evenings, some Saturday afternoons, some Sunday afternoons. We dedicated a full day where our staff, physicians, our staff of nurses and medical assistants, everybody came together. We were able to accomplish 2 big goals. En masse, we were able to vaccinate 1,000 children, roughly 25% of them VFC, and we were also able to do some team building. We have breakfast with coffee. We have lunch with pizza. Everybody smiles, and at the end of the day, when we take our deep breaths, we can see that we've made a significant difference to the patients of Pediatric Care Associates. And these children, these adolescents, are now vaccinated for what would become a little bit atypical flu season this year, as we have seen, roughly 150 pediatric and adolescent deaths so far. But again, it's been a tremendous experience to be able to turn a parking lot into a carnival experience, watch children come out crying because they had just received the vaccine, only to have smiles and a balloon put in their hand when they saw what they were getting on the other side. It was funny because this year I was talking to a mother whose child was crying, but once they saw what they were getting, they were happy. They were off with their sibling and their father. And the mother said, "Come, we have to go. It's time for lunch." And this boy started crying again. And the mother said, "What's wrong?" He said, "I want to play some more." And the mother said, "It's only for children that need flu vaccines." He said, "I'll get online again and get another flu shot." That told me we were a success. We're already planning for our flu carnival of 2018, and I'm looking forward to having my staff ready and able to give vaccines to the patients of Pediatric Care Associates. A real novel idea, and this is one of the few things I will take full credit for. If it had not come from that dream, who knows what we would be doing.
Well, thank you so much, Dr. Bienstock, for sharing your dream with us and your success We're going to move on now to our next panelist. We have with us Angela Austin, who is a Community Health Services Administration Program Specialist with the LA County Public Health Department. And I've had a chance to have a couple of conversations with Angela. I've been so impressed by the great work she's doing in LA. And when I reached out to some of our long-term partners at the Public Health Department, they highly recommended Angela. So, Angela, why don't you tell us a little bit about what you've been doing in LA and the successes you've had to promote flu vaccination?
Okay, thank you, Carlos. My name is Angela. I'm a program specialist, public health nurse with LA County. As you said, in my role, I serve as flu coordinator for Community Health Services Division, which is the branch of LA County Department of Public Health responsible for mass vaccination and community outreach. During my discussion, I will briefly cover our flu vaccine allocation process, general influenza outreach strategies, and describe some of our successes and lessons learned from our annual flu campaign. In terms of our vaccine allocation, LA County Department of Public Health Vaccine Preventable Disease Control Program receives an annual allocation of the flu vaccine from the state of California. The flu vaccine is purchased with state general funds each year to distribute to all local health departments for vaccination of underserved populations at no cost. During the 2017-2018 influenza season, the LA County Vaccine Preventable Disease Control Program received approximately 68,000 doses of flu vaccine. Of those 68,000 doses, 47,620 were distributed to community partners, including federally qualified health centers, county hospitals, nonprofit clinics, community hospitals, and school-based clinics. The remaining 20,380 doses of vaccine were distributed to our LA County public health centers. Of the 20,000 doses that Community Health Services received, we have administered 3,248 doses at our in-house immunization clinics. In terms of our outreaches, each year our field staff coordinate anywhere between 130 to 150 community flu clinics. This past flu season, we have coordinated a total of 136 community outreaches throughout the county, vaccinating 11,697 LA County residents. To date, we have administered a total of almost 15,000 doses of flu vaccine this season, both in clinics and at our community outreaches. So with that being said, each year LA County Community Health Services Division embarks on a massive flu outreach campaign to encourage populations at risk to get vaccinated. Every year, in accordance with state requirements, we target our outreach efforts to capture the under and uninsured, and specifically those that are higher risk, including the homeless, children, immunocompromised adults, seniors, and pregnant women. And in analyzing the data from prior flu seasons, we feel that our strategy has been highly effective. The vast majority of clients vaccinated at our community outreaches are children under 18, accounting for 13%, seniors 55 and above, accounting for 35%, or those that were uninsured, which accounted for 27% of those vaccinated last flu season. So to capture these high-risk groups, we target venues that serve them, including schools, community centers, churches, senior centers, homeless shelters, and most recently, we have collaborated with the library system. So a little bit about our success story. During my tenure here as the flu coordinator for LA County, One of our most successful strategies was the partnership between the Department of Public Health and the county library system. This collaboration started about 4 years ago and has proven to be a natural fit. This partnership demonstrates collaboration between two county departments with the same mission, which is to provide resources to the community, focusing on the same high-risk population. Libraries here in LA County actually have a very high homeless population and draw many children, seniors, and uninsured. The clinics have also had great turnouts with a range of about 80 to 200 clients vaccinated per site. This past flu season, we hosted clinics at 17 county library branches and vaccinated a total of 1,602 residents at these locations. Our first year doing this, we received recognition from the County Board of Supervisors and were recognized by the National Association of Counties. In terms of our lessons learned from our flu outreach campaigns, we have found that education is key. We have our field nursing and health education staff go out throughout flu season to different community and faith-based organizations to provide education regarding the flu and the benefits of vaccination. The use of culturally sensitive print materials, including flyers, and having our consent forms available in multiple languages has also been helpful. As I discussed earlier, targeting venues that serve populations at risk tremendously focuses our outreach efforts. And of course, marketing our outreach strategies online. We have our flu outreach schedule posted on the DPH website, as well as blurbs regarding flu season posted on our various social media outlets, including Facebook, Twitter, and Instagram pages. For the homeless, the use of incentives, such as hand sanitizers, socks, and hygiene kits, has also been helpful, and we hope to replicate this for future campaigns if funding allows. And that
Thank you so much.
my presentation.
Great. Thank you so much, Angela, for the lessons learned and some great outreach that you're doing in partnership, especially with the library. Our next two panelists are Kim Greenwood and Rosemary Onuegbu. Kim Greenwood is the Adult Immunization Coordinator in D.C. Department of Health Immunization Programs, and Rosemary is the Pharmacy Manager for Safeway in Washington, D.C. And I am going to have them talk about some of their efforts in relation to reaching out in the D.C. metro area, and I'm going to turn it over to Kim and to Rosemary.
Hello, everyone. This is Kim Greenwood. Welcome from Washington, D.C. Yes, the Department of Health, we have changed our new logo. We have a new brand now. So it's called D.C. Health. So sometimes you'll hear me say Department of Health or D.C. Health. We're getting used to the new brand. But, yes, we did have a successful partnership. We're grateful for this excellent opportunity to talk to everyone and share. Rosemary and I linked together with the Department of Health and our local retail and chain pharmacies. Rosemary, as you see, she's from Safeway Pharmacy, and they have a linkage already to our citywide immunization database, which we call doses. So when I reached out to Safeway to see if we could reach some of our special populations, the pharmacy was all hands on. They were excited and very willing to take this opportunity for us to immunize a lot of our district residents. Because here at the Department of Health, one of our vision is to become one of the healthiest cities here in America. So we were grateful for the opportunity with Safeway to join onto our vision and mission and make it happen. And so on the slide that you see in front of us is one of the outreach opportunities that we had with our homeless population at Emory Shelter in February, where we did immunize some adults and families, men and women, and the pharmacists came in and they immunized and they gave the flu and pneumonia or whatever vaccines that were needed at that opportunity. Rosemary, did you want to share anything?
Yes, I mean it's definitely something that as a company, Safeway is part of Albertsons companies, and it is something that we do all across the nation within our divisions. Is we try to partner with our community organizations or with the health department to reach especially our underserved population. So it could be our homeless population, or sometimes it could be our elderly population who don't always have the opportunity to get out or to see their primary care provider to get these preventive services. So we definitely work together with the medical corps, with the medical team. We do provide the vaccines, and also we do send out our pharmacists to provide the vaccination. So usually a lot of times we try to coordinate it kind of like a wellness event so that we can be able to provide additional services, so whether it be health screenings and the like. But that's definitely something that we strive to do each and every season.
One of the successes that I just wanted to elaborate about with this event is that here at DC Health, underneath our leadership, we had a lot of support from our leadership for a flu campaign. And so this year, we had the flu campaign that did marketing across our citywide buses, as well as we used a lot of different media as well. We showed it in the movie theaters, as well as we had it on our metro, subway, bus transportation, as well as our Comcast and cable TV. And our theme was spread love, not the flu. And because it was such an embracing campaign and motto, we tried multiple approaches to reach the residents here in the district. And here at the DC Health, one of our strategic priorities by our bureau or our program is to strengthen our public and private partnerships. And so that's why this connection and this partnership and collaboration with Safeway really went well across all spectrums. And you'll see on the slide, even though we worked with Safeway, that we also utilized our medical service corps here at the Department of Health, and we have one at our School of Pharmacy at Howard University School of Pharmacy. The students came in and they really took charge, as well as we worked with our other citywide agencies that work with the homeless families. And that could have been the Department of Human Services as well as Employment Services. So it was a collaboration of several agencies that worked together to make this event successful, as well as others that we have attempted throughout the flu season this year.
Excellent, Kim and Rosemary. It sounds like you really are leveraging in a variety of ways, working within the private and the public sector, and I applaud you for your efforts. Moving forward, we have our last panelist, Carol Moore, who is a Texas State NAACP Health Chairwoman. She's a retired nurse, and I know she's a strong champion within the African American community on a variety of health issues, including flu prevention. So, Carol, could you please share with us some of your successes in relation to doing outreach to veterans and using the TRICARE program as a way of paying for vaccines?
Yes, I will. Thank you so much for having me. What we're doing in the state of Texas in outreach, especially with the flu vaccines and coordination with TRICARE, is we have a major base here in Texas Hall. Just the U.S. Corps of Engineers and the Army folk and everybody else that comes to me, because it's a huge, huge military outreach. And one of the things that happened was TRICARE is the carrier. There was a breakdown in communication with TRICARE and the community and family. So we launched a program with Walgreens and TRICARE. So we have been immunizing people at community outreach fairs, setting up fairs, going to the different churches and having them coordinate with the veterans to get them to have the flu vaccine and their family. This kind of outreach is like a wheel to us. We try to make it a circular event where the people in the community know what they need and they have a place to get it. In places like El Campo and all those smaller towns in Texas, the churches were really aggressively involved in the flu vaccine. They actually put out flyers. They actually routed people to the clinic. Some of the churches use vans to take their people to the clinic to get the flu shot. So we were very successful in working with TRICARE and the community and their families. One thing that we did that is not with TRICARE is having the flu clinics in the housing project. It makes a big difference because people cannot get So a lot of the places that they're supposed to get to in a timely manner, a lot of them don't keep regular appointments, so they can't consider themselves having a medical home. So when we go into the housing project, I bring a team of clinicians from whatever city I'm in, and they can do the immunization in the housing project. We've been very successful with that. This year was a lesson learned for our vouchers. Last year we got a lot of vouchers and were able to do a lot of vaccines. This year, because of the limited number of vouchers that we had, we did not have a lot of them to give out. So that's one of the negatives that we felt. The lesson that we also learned was if we educate our community early on, not waiting until flu season is here, we continue to do it year round. So when flu season approaches, they already are in the know about what they need. So I'm pleased to hear that everybody else is doing with vaccines, and I especially am going to take the idea of having the flu come. And also that's a tremendous point. And we can use that even with our seniors, and especially with the veterans and children, because that is something that they need to be positive. We also work with our colleges. What happened with our colleges and universities, they all needed the vaccine because most of the students in the health sciences department have to have the vaccine. So we worked real closely with them to try to route them to get the vaccine because a lot of them were uninsured to get it at a clinic. Even though last year we provided vouchers, but this year we could not. So that's a lesson that we learned, and we hope that this circular way of working with the community will work better next. Thank you.
Thank you so much, Carol. Now we're going to open it up to questions from our listeners and our participants online. And I do have some questions in front of me. The first two questions I actually have are for Dr. Bienstock. Dr. Bienstock, if you're there, we have a couple of questions for you.
I'm still here, waiting for the next interval.
Excellent. So
and I'm not dreaming or sleeping.
Very good. Well, actually, part of this question is about your dream, but in relation to the carnival that you organized, I know you're a VFC provider and you have to go through a process to become a provider, but you're also doing promotion for free vaccines in a way that's quite unique. And so one of the questions I have here is, how did you pay for all the promotional activities?
We feel that that's a commitment that our practice has to serve the general public. Yes, it cost us. Over the years, while we do receive some remuneration for administration fees, we're still in the red, and it does cost us something to pay our staff, pay our doctors, the local vendors, our psychologists, dietitian, the local police, the local firemen that come either with a fire truck or a police car, do it out of their good heart. We obviously give a donation back to our public servants. But we end up in the red, but we feel en masse to have, as I said, in this past year in 2017, almost 1,000 children vaccinated. Some of what we are able to earn on our private patients helps to offset the cost of what our HMO, Medicaid, and VFC children receiving the vaccine. But again, it's still an amazing thing, and one of the mantras we've always had in our practice is to give back to our community, give back to the patients, give back to our children. I gave a talk earlier this morning at St. Joseph's Children's Hospital in Patterson on adverse childhood experiences, ACEs, and I told them, you need a home for these children. Our PCMH, our patient-centered medical home, our parents know they can call us with almost any need, and I think that's how we do it.
Well, that's incredible that you're doing it despite the fact that you are in the red, because I also know that part of your dream is to expand your efforts statewide. Can you talk a little bit about what you're doing to broaden that?
Well, the New Jersey chapter, of which I am outgoing president, I will be outgoing on June 30th, though I will stay on to do other things, I'm sure, is hoping that I can bring this carnival from the north to the south of our state. And I've been speaking with some of the key individuals in our chapter to try and have one carnival in each county. I don't know how that's going to work, and I honestly, and I can say this from the bottom of my heart, I don't think every physician, I know every pediatrician is not going to feel the same that I do with, quote, giving back. And I think I have to get them to understand that we're very fortunate to have a profession that many of us love. Again, I didn't go into orthopedics, plastic surgery to drive around in a fancy car, have 3 different houses. I'm a simple person, and I'm just happy to be able to give the care to my patients and hopefully instill this in future doctors that come, as well as the other pediatricians and caregivers throughout the state of New Jersey to do the same and, quote, pony up the same way.
Very good. Thank you so much, Dr. Bienstock. The other question I have is actually for Kim Greenwood and for Rosemary. So, Rosemary, in relation to how Safeway is able to partner with the Department of Health, is it a question that you are providing vaccines that are directly billed, or is it a question that you're also providing some free vaccines?
We actually do both. So, for example, at the image on the slide deck that we provided for the homeless shelter, those vaccines we provided free of charge. So that is part of the Albertsons Companies Foundation. We actually do provide just thousands of free food vaccines across our divisions during every flu season. So we definitely do work with our partners in certain instances to provide the vaccines free of charge. If we are providing the services, for example, at an elderly home where the patients have Medicare, as you had on the earlier slide, Medicare does cover the vaccine. So sometimes we can provide an off-site clinic at a facility that services the elderly population, and we can be able to bill Medicare for it. But we still do provide those services for free, and we do send our pharmacists to provide the vaccines as well.
Excellent. Well, that's good to know, because I know that we have met with other partners, like in the state of Texas, that also have been able to benefit from this kind of arrangement or partnership with Albertsons and Randall's and Safeway. And so I have to applaud your efforts. I know that other pharmacists have been able to support our partners in other states, not only through what we know as the Walgreens voucher program that we've had for several years, but I know that CVS has come forward and Target. And so the other thing that we know is that there are independent pharmacies that have made incredible efforts to provide free vaccinations to uninsured or underinsured individuals. So I always say that the only way you're going to be able to partner with some of these organizations is if you approach them and ask. And that's, I think, an important lesson. Did this happen by accident, Tim, or did you know that this program existed and that's how you became involved in partnership with Safeway?
So that's been the excellent thing, avenue about partnerships and collaborations here at the Department of Health. We have the Board of Pharmacy here in our building as well, and I go to that meeting every other month with another partnership and collaboration I've made with a pharmacist, Jennifer from Delmarva, which is now called Galarant Foundation. And so by going to these different board meetings or going in the community and networking, you find out about a lot of different avenues. And so at that Board of Pharmacy meeting, some of the different pharmacy students or interns or present practicing pharmacists are there. And so they always advertise or give their card and talk about their current services and what they have to offer. So when they did that, then that gave me an opportunity to build our partnerships. And then I reached out, and they didn't have any problem. Safeway they were an excellent opportunity and showed true commitment to care in order to vaccinate the residents here in the district during the flu season.
Excellent. Thank you. And I have a question for Angela. In terms of the work that you did with the library, Tell me a little bit about how you were able to leverage working with the libraries in relation to setting up that whole arrangement. Is it a portion that you talked to the head of libraries in LA and they came forward, or did you go to them directly? Did we lose Angela? Okay, we'll come back to that question down the road. And the other question I have is for Carol. Carol, you had mentioned that you are working in partnership with Walgreens in terms of being able to promote TRICARE. Now, is that something that Walgreens is able to do in relation to complementing their voucher program, or are there other efforts that you're doing with Walgreens?
Well, we partner with Walgreens for other efforts, but specifically this year we were targeting the flu vaccine because it was such a shortage, and they had offered us the voucher. What had happened in the past was a lot of the veterans were using the Walgreens flyer in their community for their actual medication. So it was a natural fit for us to use Walgreens to TRICARE had partnered with them. So we are definitely willing and are partnering with our other persons here in Texas, which is HEB and Walmart, to do the vaccine. So we did the outreach with Walgreens. We had pharmacists that could go out and give free of charge the vaccine to veterans.
Excellent. Thank you so much, Carol. Angela, I think you're back on the line.
Yes, I'm sorry. Can you repeat the question, please?
Sure, no problem. In relation to the partnership that you have with the libraries, is that something that you actually approached the library system, or the library system said, here are our community centers, here are our conference rooms, they're yours to use?
Actually, it was a result of networking, as the previous speaker alluded to. Our Director of Community Health Services, Deborah Davenport, met with one of the administrators for the LA County Library System at a meeting, and they just discussed the collaboration, and both parties agreed to go with it. And after that, they sort of gave me carte blanche to contact the different library branch managers and to discuss which locations throughout the county would be best. So I worked with the head librarians to determine what branches were geographically in areas where are of greatest need, meaning where there were the most uninsured, the most children, the most foot traffic, those that were in lower income communities. And based on that, we selected the first year we selected about 14 libraries, and they gave us their community rooms and basically access to their facilities. So it's been a great partnership.
Excellent. I think it's important that what you're all sharing is that in terms of being able to fund vaccine efforts in relation to the promotion or administration of vaccines, it's more than just being able to have access and having the vaccines paid for. It's also being able to leverage with partners in the community as a way to be able to cover some of the costs related to promotion, to housing an event, to be able to have staffing for an event. So while we can have conversations about the importance of funding the vaccines themselves, it's more than just that. It's about being able to promote and make it a reality in communities. And we're hearing time again all the successes that you're having. Now, Angela, this particular year was a very heavy flu season. It was a long flu season. It felt like there was a lot of burden in terms of being able to deal with the flu infection burden. So I'm wondering, did you see a larger demand for vaccinations in LA County?
Yes, actually, we received requests from different community-based organizations later on in the flu season. Usually, we stop at the end of February, beginning of March, in terms of our flu outreaches. But based on the need, we kept fulfilling requests to go out to different agencies up until the present. So we're still going out. The requests now are sort of tapering down, but we've been very, very busy this past flu season in terms of community demand for the vaccine at their agencies.
But you didn't have a shortage to deal with.
No, we didn't have a shortage at all.
Very good. Well, that's good to know, because I know that I've been talking to other health departments, and they have had an increase and very little pushback in terms of the demands for vaccines, because we knew that that the burden was pretty heavy across the country, and so I'm glad to hear there was no shortage. The next question I have is for Carol, coming from one of our partners in Texas. Carol, what have you learned in terms of being able to promote flu vaccination to veterans and their families?
Could you repeat that? I didn't hear the last part of it.
Yes, what have you learned in terms of promoting flu vaccination to veterans and their families?
What have we learned? What we've learned is that we had to include the families. What happened in the past, we were just trying to do the veterans. And now we are including the families in that. That has been a recent thing that happened in Texas. What has happened with the family members, though, we've gone on to other things. That when they came in for the flu vaccine, it enabled us to connect them to other services, especially the children. So that's what we learned. It was a good idea to have the whole family covered. It's even a better idea to make sure that they continue to coverage for other health care needs. And that has been what we've learned so far. And we will continue to press forward to the things we learned even from that. Because we find that even if the homeless veteran is out there and they have no information, and you tell them about a family member, and they will tell you about, I have a kid here, I have a kid there, whatever, then that kid can get some services. Where the homeless guy, he's not connected to a building, so he's wandering. He's not actually in a place. A lot of times we go into the veterans, they're living in bridges, under bridges. This is the kind of work we do. And so when we pull them out and we have a veterans event, it's very important for us to understand the mechanics of being homeless and what they need from us as an organization. We try to marry those two together with the services we get from our part. So yes, we've learned a great deal from different sites.
Very, very good. Thank you, Carol. And the last question I'm going to try to get all our panelists to respond to is, what advice do you have for our listeners today in terms of being able to cover the cost of vaccines and to be able to promote vaccines? So Dr. Bienstock, we'll start with you. What advice do you have to our listeners in terms of covering the cost of vaccines and promoting vaccines?
So, again, I don't want people to think that I'm a physician that just gives away health care. And I do try and make a profit. I still have to put food on my table and feed my family, even though my children are all out of the house at this point. But I think this is a partnership, and this is part of a public service message. Our practice was also called on by our local county when they were running flu clinics to just give them a hand and give them some direction. As the flu season really picked up in northern New Jersey, and there were a few deaths, I'm sad to report, since this really is a preventable disease. I think working along with the CDC and the VFC program and trying to ensure that people get vaccinated early, get vaccinated appropriately, and again, trying to turn some non-vaccinators into believers of how important, the flu vaccine, I think, is very important. And sometimes you don't always come out ahead financially. But again, we try, and we do find ways to be able to end up in the black at the end when we can.
Excellent. Kim and Rosemary asked the same question in relation to what advice you have to our listeners in terms of covering the cost of vaccines and promoting vaccines.
Yes, again, I wanted to piggyback on Dr. Bienstock. Partnerships. Partnerships are definitely the key. One of our core values here at DC Health is compassion. So with that, with your compassion and your commitment to care, you have to have partnerships and with the private sector as well as your own sector here. We utilize our different agencies within our building to build these partnerships and to go out to serve and immunize families with the flu. When we were talking about, when you asked about the multiple approaches, I was really thinking about how, when with this flu season, how it was not just immunizing families, but we also were able to, with Safeway already having direct data connectivity to our immunization registry, then we were able to collect the data and see how many families or individuals, residents here in the district were immunized, because it already went into our database and our registry. And we're always trying to build a citywide registry covering the entire lifespan. We do really well with VFC and the children, but we would also like to see the adults in the registries as well. So it was different approaches that made it very successful. And Safeway, not just looking at the cost, but they were willing to immunize anyone that had of the voucher, if they had insurance, if they didn't, if they were within the age range, or if they were 65 and older and could be billed. So I just think that looking at multiple approaches to reach individuals and families so that they can be immunized is great, and building those partnerships. Rosemary?
Yes, absolutely. I mean, it's really just from the partnerships, through, the Board of Pharmacy, which we do participate in. Our pharmacists do attend those events. We do participate with Howard University, with the College of Pharmacy as well. So being able to get the assistance from the professors there and the students there, just to kind of assist us with kind of setting and planning the program. So that's what the key is just kind of forming those partnerships with our community partners, and obviously with the Department of Health. That makes it very successful.
Excellent. Thank you. And Angela, what advice do you have to our listeners?
Yes, in terms of the cost, we're fortunate where we get our vaccine allocation from the state, so we're able to administer to any high-risk residents at no charge. But as everyone else has said, leveraging our community partnerships, the county library, they have a very robust marketing team, so they do a great job of promoting our vaccination clinics on their social media, on flyers. They've developed little bookmarks advertising our flu clinics that they distribute during at the different library branches. And also attaching it to an existing health event. We do a lot of health fairs, a lot of community outreaches where we also promote the flu and the need to get vaccinated, letting our residents know that they can go to a local public health clinic and get vaccinated at no cost.
Excellent. And all that has value. Incredible. That's very effective. Mm-hmm. Carol, what advice do you have for our listeners in terms of having the vaccines covered as well as promotion efforts?
The only recommendation that I would have is about vouchers, because when we start out, we are only given so many. So that number probably needs to be pumped up just a little bit. That would help us a great deal. And I know everything costs money, so we're really aware of that. But when those costs are figured into community, we have to look at the fact that you get vouchers. Some of people don't need a voucher. They need to utilize their insurance. Some of the kids that came in, they could have paid Medicaid instead of taking care of it. So we're doing a good screening process of the kids or whoever comes in for the vaccine. So we don't have to use vouchers for every single person. So that's what I would recommend, is that we talk about numbers for the vouchers a little bit more, and that we aggressively screen people that really don't need a voucher, but they're in line that they have Medicaid numbers. That's the only recommendation.
Excellent. Thank you. I want to take this opportunity to thank everyone that's been on the panel today. You've been wonderful, providing some great insights and advice, and sharing your success stories in terms of what you're doing to promote flu vaccination in your own local health jurisdiction, but also finding innovative ways of being able to cover the cost. I know for some, they have the opportunity to receive dollars directly from the state. For others, it's about being able to promote with a particular underserved communities. And the important part, and this is the key message that I've heard over and over, how important it is to establish partnerships that work, partnerships that can make a difference, partnerships that can leverage resources as a way of making an opportunity for more people to be protected against the flu every year. So I really want to thank all the panelists for their time, I want to thank the CDC team for all their efforts in supporting this webinar, and all the great people at Kaufman and Associates, Kim, Adam, Jonathan, Amy, Aaron, and so forth, who are part of the support team and the team at Interday Associates, Alfonso, and Charles for all their hard work. And I want to thank you. I'm going to turn it over to Adam, who has some reminders for us. Adam?
Yes, thank you, Carlos, again, and thank you again to everyone for attending. We will have a few evaluation questions, so please fill those out. As a friendly reminder, today's webinar was recorded, and the slides and the recording will be posted on the NIVDP partner page at cdc.gov. Thank you again for joining, and we'll have our evaluation questions posted shortly.
Yes, keep in mind that there may be a pause once we sign off for the evaluation questions to pop up. But we ask your patience. Feedback from you is very important. And with that, we're signing off, and thank you so much for participating.